What if the biggest battle you fought was not against the world, but within yourself? This is the harsh reality for those who engage in self-harm, a psychological phenomenon that's more prevalent than we might think. Self-harm, also known as self-injury, is the act of deliberately causing harm to oneself. It's often a method of coping with emotional pain, intense anger, and frustration. But what drives a person to harm their own body as a means of dealing with their internal turmoil? And what can we as society do to help? There are various causes that can lead individuals to self-harm. One of the main causes is poor coping skills. Non-suicidal self-injury is usually the result of an inability to cope in healthy ways with psychological stress and intense emotional pain. Another cause is difficulty in managing emotions. Individuals who struggle with controlling, expressing, or understanding their emotions may resort to self-injury. The mix of emotions that triggers self-injury is complex and can include feelings of worthlessness, loneliness, panic, anger, guilt, rejection, and self-hatred. Personal experiences such as being bullied or facing questions about sexual identity may also be part of this emotional mix. According to Dr. Michael Hollander, a renowned expert on self-harm behavior from Harvard Medical School, self-harm is a complex coping mechanism. It's not about seeking attention, as some might perceive, but a desperate attempt to manage overwhelming emotional distress. He explains that the physical pain of self-harm often distracts from the emotional pain one is experiencing, providing a temporary, albeit harmful, relief. Self-harm, however, is not limited to physical manifestations. Psychologist Dr. Janice Whitlock from Cornell University emphasizes that self-harm can also be emotional, like the act of self-isolation, or engaging in destructive relationships. Both physical and emotional self-harm create a vicious cycle that can be challenging to break. Let's take a moment to delve deeper into the science of self-harm. A notable 2010 study in the Journal of Abnormal Psychology by Franklin and colleagues provides further insight. They used a task that measured people's defensive eye blink responses before and after they submerged their hands into ice-cold water. The results were startling. They indicated that self-injurers do, in fact, experience a sense of relief afterward. This study further underscores the complex nature of self-harm as a coping mechanism and highlights the urgent need for comprehensive interventions. Having delved into the science of self-harm, it's now important to understand a concept known as pain offset relief. This is the reduction in negative affect or emotional distress following the removal of a painful stimulus. It's believed to be one of the reasons why some individuals engage in self-harm. The temporary relief experienced after self-harm can reinforce the behavior, making it a difficult cycle to break. This cycle of pain and relief can be particularly challenging to interrupt without professional help. Understanding this concept is crucial in comprehending why self-harm can become a recurring behavior and further emphasizes the need for a holistic approach to treatment. Understanding self-harm is just the first step. Addressing this issue requires a holistic approach. Experts like Dr. Hollander and Dr. Whitlock suggest a combination of cognitive behavioral therapy, dialectical behavior therapy, and other therapeutic interventions to help individuals learn healthier coping mechanisms. Moreover, fostering a supportive environment is crucial. Society needs to break the stigma associated with self-harm, encouraging open conversations about mental health. As Dr. Whitlock puts it, when we can talk about self-harm without judgment, we create space for healing and understanding. So, what have we learned? Self-harm is a complex coping mechanism for emotional distress. It's not about seeking attention, but rather a cry for help. It's not limited to physical harm, but can also be emotional. And most importantly, it requires a multifaceted approach to treatment and an understanding, supportive environment for healing. Remember, if you or someone you know is struggling with self-harm, seek professional help. There is no shame in reaching out. In the words of Dr. Hollander, the bravest thing you can do is to ask for help. Thank you for taking the time to understand this sensitive topic. If you found this information valuable, please subscribe to the channel. Together, we can spread awareness and contribute to a more understanding and supportive society.